My name is Dr. Cheryl Burdett, co-founder and educational director at Dunwoody Labs. Our Dietary Immune Test 588C, 588 Complete, is a test designed to look at not allergies or sensitivities, but immune function. We're the only test out there that combines multiple ways that the immune system can react to foods, giving you a more complete picture, making sure you're not missing what's most important for that patient. Our test starts by looking at IgE, and this is the common way that we are trained to think about reactions to food. An allergy. We can go into anaphylactic shock, shortness of breath, hives, headaches. But our immune system doesn't stop there. In fact, we work very hard to not be reactive to foods. We don't want to have a life-threatening event from a food, and so the immune system goes on to mature. We're the only test that looks at that next step, that looks to see, are you allergic, and has your immune system become tolerant to this, even if initially you had an allergy. We've all experienced this with patients, someone who will tell us, well, I had a dairy allergy as a kid, but I grew out of it. And in fact, that is accurate. The immune system works very hard to help us out, to protect us. So, if you have developed an allergic reaction, the immune system works to protect you and moves on to develop something called IgG subtype 4. We also measure those reactions, so in one test you can assess, are you allergic, and has your immune system become tolerant to that food and you've now overcome it. This is clinically meaningful because it means that if we see that someone is allergic without that immune tolerance, without developing IgG subtype 4, it means that that opens up avenues of treatment to them. We can suggest desensitization done through injections or sublingual immunotherapy to increase the levels of IgG subtype 4, blocking IgE, blocking that allergic reaction. In addition to that, if IgG subtype 4 gets high enough, it can create other conditions, not allergies, not sensitivities, and not inflammatory driven, but the IgG4 can precipitate out into tissue, the esophagus, ovaries, prostate, and can cause problems in those areas. So now, if we know what part of the immune system is most at play with particular conditions, we will measure it and know what's most important for our patient. But it doesn't stop there. After we make a first reaction to a food, our body could choose to be allergic to it, we could overcome that allergy, or sometimes the immune system is confused and we become sensitive to a food. That's an IgG reaction, predominantly driven by subtype 1 and 3. These type of reactions will not be life-threatening events to our patient. They will not create anaphylactic shock. They will not create an immediate reaction, but they create ongoing inflammation in the body, and that inflammation washes over our genetics to increase expression of pathology, to increase intensity of symptoms. And so from headaches to depression to ALS, if we can figure out foods that are creating inflammation in the body and we can calm those things down, we have the potential to calm down pathology, to calm down symptoms, and more completely help the patient. So we look to see, are you allergic? We look to see, now, has the immune system developed tolerance to that, a specific IgG4 response to foods? Then we go on to see, are you sensitive? What are your levels of IgG1 and 3 that create this ongoing inflammation? Not immediate symptoms, 3 to 72 hours after we've eaten a food, but symptoms and inflammation that can make most pathologies worse. However, it doesn't just end there. Most tests only look at sensitivities or look at that IgG reaction. They do not go on to look at complement. Complement is one more way the immune system can react to foods, and complement might be one of the most devastating ways that we can make an inflammatory response to food. In fact, if there's an IgG titer as well as complement present, the two can bind together. And when complement binds to IgG, it amplifies that allergic reaction 1,000 to 10,000-fold and tells you which foods are most important for your patient to avoid. If you've worked with sensitivity testing in the past, you may have had the feeling that it didn't match clinical symptoms. You may have found that where people had lower reactions, IgG reactions, this was curiously where they actually had the highest amount of symptom. Well, the reason for that is if you're only looking at IgG and you're not looking at complement, you're not looking at that switch that can amplify the reaction. So when we measure IgG as well as complement, we know which foods are going to create the most inflammatory potential in the patient, and it again allows us to individualize further. If we can look at, are you allergic? If we can look at, have you developed tolerance to that allergy? If we can further go on to define, are you sensitive, and is that sensitivity amplified? Now, rather looking at a single point in the immune system, we're looking at the immune system the way it was intended to be looked at, as just that, a system. And when we look at multiple ways the body can react to foods, we have a more complete picture, a greater understanding of how to help that patient. Now, one of the limitations of lots of information is confusion. A patient can say, well, I react one way but not another. What does this mean? Our dietary antigen test goes on to help the patient by providing diets and a rotation program. In fact, 2 diets, a more restrictive diet and a less restrictive diet, so you can choose what's best for your patient. In addition to that, we define food families that the patient is reacting to more, giving you more clinical flexibility to be able to say, okay, I think that even though we've removed certain foods, this family is problematic for you, so we're going to take out the family of grains, or we're going to do a more amplified candida diet based on the family of funguses that you're reacting to. So there are many reasons that the dietary antigen test is one of the best tests out there, unique to Dunwoody, in that we put all of the pieces together so you can understand more completely what's happening in your patient, as well as having those support materials available so they can make sense with it, so they can be compliant with it, so it makes a difference in terms of helping them get well. The dietary antigen test is cutting edge, giving you the most sophisticated information around food, the opportunity to help lower the inflammatory load most completely, helping your patient in many conditions from headache to pain to weight gain, reducing inflammation, and letting food be thy medicine.